I think the big impact that we're seeing is on people's mental health. It's been really, really tough. The anxiety at the beginning of not knowing what was happening. A lot of people then weren't able to work. Homeschooling was really, really difficult for a lot of people. Just so much change. It was really tricky for everybody. And now we're seeing a lot of patients coming to us with mental health problems. They have anxiety, they have depression. Sometimes they're struggling with other social problems as well. They've become quite isolated.
So I have a long-term health condition, and as a consequence of that, I was in the shielded group, and that had a huge impact on me. So normally, as I'm a nurse, I've worked at the hospital for many, many years, and I'm used to being with people, and then all of a sudden I wasn't.
Staff in primary care were as shocked as anybody when all of this started, and we were all trying to process what was happening at the time. We had some patients that were frightened to come into the practice. We had some staff that were actually afraid to come to work as well. We didn't fully understand the risks ourselves. We didn't know at that time what was the mortality rate.
Also, people were really anxious about what should they wear, what masks should they wear scrubs, should they wear other protective clothing.
It's been a really challenging couple of years, having to completely adapt to work in different ways to what we normally have done. And there's been a sustained period of pressure now for a very long time, and seeing that take its toll on sort of your colleagues that you're working with, on patients that you're seeing as well, can be quite tough too.
So there's the obvious stuff, we've had a lot of people who have lost their jobs and an awful lot of people on furlough. And whilst it might seem great to be paid 80% of your salary to stay at home, actually that's had a really devastating impact on people. When you're already on a low income, to lose 20% of your income, even to stay at home, has had a huge impact on people. So there's the obvious thing about, not working, having reduced income, but actually the pressure that puts on relationships, on families, as well as the additional pressure of having to homeschool children and all of the things that come with that. So it really has been an extremely difficult time for Gateshead residents.
Lots of people needed help who maybe had never ever needed help before. They had never asked for help. They had always been self-sufficient, but suddenly they found themselves furloughed. Maybe if they were self-employed, the rules changed quite a bit, so sometimes people found themselves without any money and unexpectedly, and had never had to come, particularly to a charity or to ring any number before to say that they needed help. Even if it wasn't financial, they just needed someone physically to go and get their shopping or to get their prescriptions. That was hard for people, I think. I think the pandemic was an interesting time that shone a light on inequality and the impacts of inequality in our communities. If you have to be locked down 24 hours a day and you are overcrowded in your house, or you haven't got space, maybe parents are trying to work from home at the same time as the children are trying to learn at home, and you haven't got the space and possibly the facilities to do that. Digital inclusion became a massive issue because everything went online, but actually some people didn't have either the hardware or possibly the credit to connect, so that became a big issue too. And money, just having that disposable income. Maybe if you've got a little bit more money, than if your children are really getting restless because they're not able to go out, you buy them another game for the computer, or you can buy a takeaway, or you can have those little treats that make it bearable. But actually for folks who haven't got that and haven't got that disposable income, then it becomes an almost unbearable mix of being stuck in together with no money and no possibility for a sense of taking control of that.
So we know that COVID has had more of an impact on some of our patients who come from more deprived areas across Gateshead. So for example, the patients who smoke, some of the patients who have more unhealthy lifestyles, we know that they have been impacted more, and it's certainly affected their health. And if they've developed COVID, then the outcomes have been much worse.
And I think certainly financially as well, there's been people, it's often the people that are struggling to begin with that are hit the hardest, and people that haven't been able to go to work because there's no other way of doing their job unless they go there, have been really hit hard when they haven't been able to work as a result of restrictions throughout all of this.
There's no doubt in my mind that inequalities have worsened as a result of COVID. We have many, many families who were only just coping who have slid down into being vulnerable or extremely vulnerable. These families weren't visible necessarily to us before the pandemic because they were just coping, using their existing networks to be able to support themselves. But those networks have wobbled as a result of all of the difficulties that we've had over the last sort of 18 to 24 months. And they've fallen into services and become very visible to us. We also have huge numbers of children living in poverty. In some of our most impoverished wards, that's as many as 60% of children living in poverty. In the very early days of the pandemic, when there was an awful lot on the news about things like furlough and redundancy and unemployment, we received a huge number of enquiries about those types of issues. But then it changed slightly, and as people started to experience the impact of those things actually happening, the inquiries then started to be about things like benefits, about employment rights, about grievances. And we had a lot of inquiries about universal credit, with many people claiming universal credit for the first time, and we had record numbers of people coming to us about that. But then as the year progressed and the winter started to take hold, those inquiries started to change again, and we had a huge record numbers of inquiries about energy advice. In December of 2020, we had the highest number of inquiries for energy advice in the history of our service.
You have the effects of kind of this new way of working and, remote consultations, and they are fantastic for a lot of patients. We've got patients that absolutely love those, but for some patients that just excludes them further because they don't have access to, smartphones and the IT that others do. We are, in terms of the vaccine programme, we were seeing that actually the uptake of the vaccine was less in areas where there were, high levels of deprivation.
The true impact is yet to be felt, because many of the things that you would expect, things like debt collection, the rent arrears, evictions, those things have been on hold during the pandemic, and they've only just recently been reintroduced. So some of the effects of the pandemic have been held back artificially by these mechanisms that have been designed to give people relief. But that debt and those rent problems haven't gone away, and in fact in many cases they've been building. And now that we are back in a place where debt enforcement and rent collection and evictions are going to happen, the impacts are really going to become visible over the next 6 to 12 months. So the hubs were a collaboration between the council and the voluntary sector, recognising that actually we're stronger together, and if we work together we can maximise the impact and resources that we have. Initially the hubs were a distribution network for food, but they've grown and developed into something which is a real community response that provides everything from emergency food through to routine shopping, through to befriending, through to advice, information and guidance. And they've supported over 18,500 people with food parcels, many more with other issues as well. They've delivered free school meals, packed lunches, oxygen monitors. A huge range of services have come from the hubs.
During the pandemic, we did a whole range of activities to support our local communities, and that was partly working in partnership with the council to run the local food hub. Quickly became apparent that actually people were accessing that who were also impacted by poverty and not just COVID. And we also tried to do all sorts of things in our communities according to what we felt our communities needed, just to keep people connected and keep them together. So we did online cooking courses, we did online coffee mornings, we did online young people's work, we delivered activity bags to people's houses, we delivered food bags to people's houses so they could make food together. Anything really that really kept that sense of connection that is so vital. One of the happy things that came out of such tragic situation is the way I think that communities were able to respond. How maybe people spoke to each other who had never spoken before. People were looking out for each other in a way perhaps that they hadn't. looking out for their neighbours, knocking on doors and asking people if they were okay. I know on some of our estates they met out in the street when that was possible again, played bingo in the streets all together, maybe making food and meals for one another, a real sense of pulling together. And I think that also happened at an organisational level too.
So we resorted to buying our own PPE. We were actually buying our own, but actually what was really lovely was that the community helped us out as well. So at the time we had a lovely lady in Low Fell had rallied a group of people to make scrubs. We had a shop in Dunstan had donated some masks for us. We had lots of local businesses and actually patients as well donating things like visors. We had seat covers from businesses. It was really fantastic because actually that's what helped us through those early days.
So one of the things that's been really beneficial throughout the whole of the pandemic is the fact that I've been part of the MEC group. And I think from early on we realised this was a really good opportunity forward to extend that into being COVID champions. And so it meant that I could give really good information out to the community about what was going on at the hospital. So my role as a champion was very much working with the public health team at the local authority and then passing out those key messages to the community.
The Young COVID Champions programme started as a response to the fact that we felt that our children, particularly around 7 to 11, were maybe struggling in the pandemic. We were coming across young people who are having rising levels of anxiety, a sense of confusion. School was a very different place at that time and everything was changing. We felt it was really important to give our young people a sense of control and agency over what was going on.
Any patients or relatives visiting the hospital will have seen things have changed quite considerably. We now have areas of the hospital that are specifically for COVID and areas that are COVID free. We've introduced a staff testing service as well as a pre-elective patient testing service. We have worked throughout the hospital to ensure that our patients are safe. It's been a very challenging time, but it's been very good working in a team closely together to make sure that everyone's on board and safe.
I would say most of my colleagues would say that they really enjoyed working in the vaccination service. It was a time when we began to see all of our patients back in the practice, which was just absolutely lovely after not seeing them for so long. We were doing lots and lots of appointments and seeing literally hundreds of patients every day, and we needed extra staff to be able to do that. So we had lots of retired GPs coming back to help us. We had retired midwives and nurses. We had lots of staff as well that are actually, working in practices, just doing lots of extra hours.
And also on a sort of regional level as well, the whole of Gateshead, throughout the PCNs, all the different surgeries have been working really hard together to try and continue to roll out the vaccination programme and make sure they're keeping up with the core general practice work that we need to be doing as well.
I'm really proud of how everyone in the Gateshead community has come together throughout the pandemic. We've worked really hard, and I think it needs to be recognised the difference that health and social care staff have made.
Things have changed a great deal for all health services across the UK. Here in Gateshead, we've gone from a situation where nobody even heard of COVID 2 years ago to now being absolute experts in how to care and manage for patients. But that's come through a lot of learning and a lot of time working really hard looking after these patients. And it's been very challenging, but we've learned a lot, and now we offer a very high level of COVID care for our patients here in Gateshead.
So one of the positives is that we've been able to use technology more. So we would never have been able to encourage our clinicians to use virtual clinics or have telephone clinics, but we've developed and been able to do that, and actually some patients prefer it. So that is definitely one bonus. I mean, we still want to do face-to-face, don't get us wrong, but actually it means that we can see sometimes more patients in a day if we're using technology. Also, it's meant that teams have had to work together, and probably partnership working has never ever been so important.
I think one of the lessons is actually that we can all be very proud of the NHS that we have, and it's been under a considerable amount of pressure for a very long time now, and it's kept on going and it's held up to that pressure. I think there's been a lot of changes that have been forced upon us during the pandemic, and actually we're finding that there's lots of new ways that we can work that are actually better for long-term benefits for patients as well.
The agile way of working that we've all embraced is phenomenal. Citizens Advice Gateshead before the pandemic could never have described itself as an organisation that was agile, but now we have all of our staff and volunteers working remotely and agilely, so they can access the systems that they need to access from anywhere in the borough, which means that they're much more fleet of foot, which is fantastic for us, fantastic for clients, and gives the employees great flexibility in how they choose to do their work. So there's absolutely no way that we'll go back to our old way of working. The other thing to say is that the way that agencies have worked together has been phenomenal.
What the pandemic did show us, though, is actually we're able to move very quickly and very slickly if something emergency hits. And the collaboration that happened during COVID, the recognition of the importance of community groups and other grassroots organisations to really be responsive and reactive, and sometimes to be the first at the point of need, I think is something that our system can really learn about. How can we collaborate together more effectively, public sector organisations and the third sector as well, to really meet the needs of our communities going forwards, levelling up and addressing inequalities in the way that we have done during the pandemic. I think we really need to grasp that.